North Carolina's top health official is in D.C. today. Department of Health and Human Services Secretary Cody Kinsley was invited to speak on a White House panel today about North Carolina's COVID-19 vaccine distribution efforts.
CBS 17's Judith Ratana digging deeper into how successful that has really been in vaccine equity.
Close to 17 million doses of the COVID-19 vaccines have gone into arms in North Carolina. Health Secretary Cody Kinsley says fighting health inequities is a priority.
And what we found that really worked was being able to see where we needed to go.
It's why the state used U.S. Census tracts to map, allocate, and promote vaccination. It also recorded demographic information for all vaccine recipients. The CDC recognized these efforts in a report last year.
We closed the gap as far as vaccinating on par in our Latinx community, our Hispanic community, and we nearly closed the gap in our Black African American community.
But he knows there's more work to do. In North Carolina, among the least vaccinated groups are American Indians at 33% and African Americans at 52%. Nationally, 74% of American Indians and 49% of Black people are vaccinated. Kinsley believes continuing to use community organizations is key.
I think we've got to get the conversations about vaccinations less coming from people like me and more coming from trusted resources.
While the panel looks to the future of COVID vaccines, Kinsley is also focusing on monkeypox. A big issue for him is the difference between COVID funding and monkeypox funding so far.
I want to use some of that for monkeypox, and I can't because those dollars aren't monkeypox dollars.
Well, Secretary Kinsley touted North Carolina's vaccine distribution, but how did we do in our overall vaccine push, and how does that compare to our neighboring states? I have those answers for you online in my story at CBS17.com. Judith Ratana, CBS 17 News.